The solution here is what I'm referring to as cost disclosure at the point of care. Now, the benefits associated with cost disclosure at the point of care, I can't remember. So I have to read them from my list. And they are this. Number 1, cost disclosure at the point of care gives patients the information they need to make sound medical and financial decisions regarding their health care. Number 2, cost disclosure at the point of care allows patients to negotiate with the provider and or seek alternative care in the event that they cannot afford the treatment option recommended to them. Option number 3, cost disclosure at the point of care supports price competition where decisions are made and before costs are incurred. Like any other product or service, once costs are identified, they can be compared against other providers. Mobile internet websites such as eBay, Angie's List, Facebook, Twitter, Google, etc. enable cost comparison in real time. Number 4, cost disclosure at the point of care empowers physicians by centralizing cost information from pharmacies, laboratories, medical supply companies, specialists, hospitals, and even insurance carriers at the point of care when and where that information is needed. This supports better treatment outcomes because the physician knows that the treatment recommendation will actually be implemented. This also enables companies like CVS, Walmart, Walgreens, the local pharmacist, the local medical equipment supply and rental company, hospitals, pharmacies, laboratories, etc., to compete using a number of different competitive strategies. Foremost among them should be price, availability, selection, luxury, volume, and even promotional coupon discounts, all of which further reduce the cost of healthcare for you and I. Finally, number 5, cost disclosure at the point of care provides patients with the information needed to manage medical bills by enabling them to compare pre-treatment cost disclosures to the actual charges. The pre-treatment disclosure gives them a viable recourse for protecting themselves from overbilling, inaccurate billing, fraud, and abuse, further reducing healthcare costs. Now, why isn't cost disclosure at the point of care the cornerstone for healthcare reform in our country today? And the answer is simply that President Obama and Congress, with the help and support of medical providers, suppliers, and payers, the primary beneficiaries of the current system, have carefully framed the healthcare reform conversation around insurability rather than costs. Insurability, without the cost disclosure at the point of care, is another way of saying protect the profits of the status quo. By advocating universal health care coverage without first requiring cost disclosure at the point of care, the beneficiaries of the current system will add billions of dollars in new revenue annually to their industry. Only a politician would think that it makes good sense to mash the accelerator to the floor when the gas gauge reads empty. And yet this is exactly what you would be doing if you provided every American insurance without first requiring cost disclosure at the point of care. When 45 million additional patients are rammed through the current system, it's going to increase the cost of health care for all of us. And it's going to increase the tax liability for hard-working Americans like you and I. It is ethically and financially irresponsible to enact any legislation targeted at providing every American with insurance without first addressing the issue of cost of care. I have a plan to reduce healthcare costs in this country, and it's very simple. Require physicians to disclose cost of treatment when the patient, that is, you or myself, are making financial decisions and medical decisions with dire implications to the quality of our lives. The only way to reduce the cost of healthcare in America and improve access to it is to disclose costs at the point of care when medical and financial decisions are being made. An informed consumer can exert pressure on the providers to lower costs while making medical and financial decisions for him or herself. Now, I know what you're thinking. Okay, that sounds good, but how do we get there? The one thing that we cannot do is outsource the problem to professional politicians who have done absolutely nothing to lower healthcare costs over the last 30 years. The healthcare problem, like all the other major problems that our country is currently facing, such as high taxes, rising unemployment, violent crime, rising dropout rates, etc., is but a symptom of a broken representative democracy. The key to effecting change is exerting tremendous financial, political, and social pressure on the gatekeeper of the current system, the primary care physician. Specialists like cardiologists, surgeons, etc., depend on primary care physicians for referrals. Hospitals depend on them for admissions. Drug companies depend on them for prescriptions. And insurance companies depend on them to provide services to their clients. Now, I know what you're thinking. On this last one, you're scratching your head and you're thinking, but I thought insurance companies were on my side and negotiated with doctors to reduce costs on my behalf. The truth is easy to see when you put it in the right perspective. Would you pay for medical insurance if there were no physicians in the network? Hell no, you would not. The stark reality is that insurance carriers are dependent on physicians for their income, and as such actually have very little bargaining power over them. There are only about 250,000 primary care physicians in America. That's good news, because that means that 300 million Americans can kick the crap out of them, rhetorically speaking, that is, and exert tremendous financial, political, and social pressure for them to implement cost disclosure at the point of care. The other medical providers, the specialists, the suppliers, and insurance companies will fall in line. Because, like I said, their income is dependent on the primary care physician. And because they would look like greedy, self-serving bastards if they failed to get in line behind the patients that they serve. Here's my plan and the answer to what do Rosa Parks and the thousands of civil rights protesters from 50 years ago have to do with combating rising healthcare costs in our country today? Remember the great generation of American patriots who fought for civil rights in the 50s and 60s? They showed us the way. They showed us how to fight the status quo and proved that their strategy works. They risked